Hi everyone. So I'm waiting for Manasa to join so that we can begin our interaction.
Hi,
Hi.
hi Manasa.
Hi. Hello. I hope you can hear me.
Yeah, perfectly. Can you hear me?
Yes, yes, it's all great.
Yeah, okay. So let's begin.
Yes, definitely.
Yeah, okay. So hi everyone. Welcome to Girls Buzz, and as you know, I'm Samyati from Girls Buzz. We keep interacting with women who encourage us and inspire us in every tiny bit. And today we have with us Manasa, and I hope I'm pronouncing your name correctly.
Yes, it's
Um,
Mansa. Yeah, that's correct.
okay, all right. She's a speech language pathologist, audiologist, and if I say it won't be wrong that she's helping the world to get better in normalizing therapy. And Manasa, welcome to Girls Buzz. If I've missed out anything, please feel free to add and tell us something about yourself.
No, no, I think you covered it. So I'm a speech language pathologist or a speech
Yeah,
therapist and an audiologist. So I started this page called Happy Chris I think 3 years, like right now. So it's been 3 years, and I just wanted to talk about spreading awareness about disabilities, about what speech therapists do, and that's basically
yeah,
what I do.
absolutely. So, what exactly is a speech language pathologist?
So basically, a speech language pathologist is somebody who helps people who have difficulty in communicating. It could
Okay.
be either children, adults, adolescents, even older people.
Yeah.
Anybody who has difficulty in speaking, in talking clearly, in speaking fluently, in probably
Right.
understanding whatever is being said. Anything with respect to communication as well as um, feeding or eating. If they have a difficulty, we help them with that. That's what a speech language pathologist predominantly does.
Okay, that's great. And that is the sweetest thing to do, actually.
Yeah,
Um,
working with kids is a blessing.
yeah. Oh, yes, definitely. It must be. And actually, we would like to understand from you that what is the difference between a speech pathologist and a speech therapist?
Oh, it's the same thing. It's just it has
Okay.
different terms in different countries. In
Yeah.
India, we usually call speech therapist, but speech
Okay.
pathologist, speech therapist, all of that is the same.
All right. So, here is a reminder to all the people who are hearing us. If you have any kind of question related to the things we are talking right now, you can put up in the comment section or in the question bar. We will take it after the interaction is over. And yeah, and moving on to the next question. We have really seen like went through your account, and it's full of cute little things about being an audiologist and the things you do. So we would like to know that is there any inspiration behind it or a real life experience that you share among your audience?
So I usually draw whatever I see in real life. So a lot of the kids
Okay.
who I interact with every day, I work in a clinic, and the
Yeah.
kids I interact with every day, the kids I see, based on the interactions which I have with my patients, that's what I end
Yeah.
up drawing, and I put it up on Instagram. So because I interact with both children for speech
Yes.
therapy as well as adults, either for speech therapy or for audiology, that is for hearing difficulties,
Yeah.
all of that I end up drawing, doodling in my iPad, and I post it on Instagram. That's how I wanted people to know what we do in a fun way.
Yeah, that's actually beautifully depicted through your art form, and it's
Thank
really
you.
artistic to watch. Like if I go through your profile, it would be I'll watch one and then I'll go on watching one after the other. It's really
Oh,
interesting.
thank you.
Mansa, who can approach a speech pathologist for
Uh,
guidance?
So anybody who has difficulty with either speaking clearly, it could be a difficulty like in speaking fluently, as in they may be having stammering or stuttering or some sort.
Okay.
A person who has difficulty with their voice is not like how they would want it. A person who has had, who's probably lost their speech after an accident or after
Yeah, yeah.
a stroke or something, or
Trauma and
any
all. Yeah.
adult who has difficulty. Coming to children who are born with a disability where they're not able to speak like other children,
Yeah.
children with autism where they don't communicate like other children do, they have some differences, or any child who's just lagging behind, a 3-year-old who's not talking like a 3-year-old should, talking like
Yeah.
how a 1 or 2-year-old could. Any
Yeah.
child or an adult who has difficulty in understanding and speaking, they can approach an SLP or a speech pathologist, and we can help them bridge the gap which they have.
Yeah. Right. So, how exactly can speech therapy help them if they are
So
dealing with these kind
usually,
of problems?
yeah. So
Yeah.
for children, speech therapy in speech therapy for kids, what we do is we help bridge the gap which they have. We help
Yeah.
them able to communicate with their parents, with teachers, with children of their age. We make them as par to the other kids of their age. For adults, we
Okay.
help give them confidence. We give them tips in which how they can speak clearly or more fluently.
Yeah.
Basically, it's like we have a set of techniques for each child or each adult for each diagnosis. We work
Yeah.
with them for a few sessions because it's not something which you can make it okay in one session or in one sitting.
Yes.
It's not like you can give a medicine and make them talk. So
Yeah.
in
Yeah.
speech therapy, we'll usually sit with them weekly once or twice, and sometimes even more than that. And we continuously work along with them to help them communicate just like everybody else.
Okay. So it is all about how you help professionally. But when we consider this problems arising inside our family, what would you suggest? How being a family member, how can we help if someone is having this problem?
So whenever we take therapy, I usually always involve the family. Like you said, it's very important that the family members know what to do or how to handle the
Yeah.
situation, right? So I'll usually call them and ask them also to sit inside, the mother, father, grandmother, whoever is there. At least
Yeah.
one or two people from their family should sit and see what exactly I am doing. So I also tell the parents, I give them tips after each session that, do this with your child, don't do this. I usually tell them they have to be patient because they need to understand speech is not
Yes.
something which is developed. Like a baby is not born with the ability to talk. They learn with
Yeah.
in the 1 year which they're here, right? So for this, you might need them to, learn, uh, give them techniques, give them tips, be patient with them. For the child, you need to give them a lot of opportunities. For adults, you
Yeah.
need to learn to modify yourself. Don't be impatient. Give them a lot of time. All of that. That would really help them out.
Yeah. It is totally correct if you say we need patience while dealing with people facing problem because they are themselves facing this kind of issues, and if we keep them in a rush, then that would be more difficult for them.
Yeah, yeah.
Yeah. So, Manasa, what do you feel, which is the most generic problem among these people? Like, why they face difficulty in speaking or hearing, like that?
Like if you want to say it, if you want to see now, a lot of kids are being diagnosed with a speech delay or autism. Mainly
Yeah.
these days, the diagnosis has increased because maybe one is because of the increased awareness. Another reason for speech delay to increase like anything is because of increased screen time. A lot of parents are working and they
Yeah.
probably would give the child mobile or TV to look at. So, that time you can't really, you can't blame the parents also. You can't say that
Right.
they are the
Right.
reason for this. But screen time has increased, and during the pandemic, kids haven't got the opportunity to interact with
Opportunity to
other
interact.
children.
Yeah.
Yeah. No preschools are working.
Right.
So, all of that was one of the reasons why this speech delays increased a lot in the past 2 years.
Yeah.
Predominantly because I could say we call it a pandemic delay itself. Because of this, they're having a delay. And a lot of people are aware these days. So they go to a speech therapist, they get a diagnosis. So a lot of these things are just increasing. You could see that because of people's awareness being improved.
Yes. Absolutely. So, there is a myth that if a child is facing some kind of speech problem, then parents or the family members generally consider that they will outgrow it
Mm-hmm.
eventually. So,
Yeah.
how far this is true?
So, see, not all kids would outgrow this, as in, because see, some kids actually have a disability. You can't expect them to just learn it and come out on their own.
Yeah,
Just some kids need a push, even if it's not a major disability. If it's just a delay, even then,
yes,
having an opinion or a help from a speech therapist will help them out. You will give them a push, and you can help them be able to, communicate like others with other children. So
yes,
not some children do outgrow it, but why do you want to take the risk? Best to always go to a speech therapist and get a second opinion. So you can help
yeah,
them if required, and you can always help them out of this.
totally. And this will also help them to detect early so that
Yeah, this
they'll know the
will.
procedure. Yeah,
Yeah, the earlier is always better, na, because less than 5 years is the best age for you to start any kind of therapy because the kids are
okay,
developing at that time, and you can start as early as 2.5 years of age.
okay. According to you, what could be the activities that in family we can perform to help someone who is dealing with this problem?
So one thing is that you can um, so in at home, if you're talking about kids, first thing is that
Yeah,
reducing screen time is very important. That
yeah,
you shouldn't really give them a lot of mobile time or this thing where you just let the child stare at the screen and leave it. If you're interacting with your child, if you're using it in an interactive manner, okay, but otherwise just passive screen time, no, that they need to cut down on. Then other things which
okay,
they can do is like pretend play. They use puppets and they play, or they use
yeah,
dolls and they make something. A lot of different things you can do is also helping them with sorting activities, helping them with painting, helping them with any kind of art and craft activities. All of that would help a lot.
yeah. Being an audiologist, other than hearing aids, is there anything else that can help with hearing loss issues?
So a lot of we would suggest hearing aids, which is the best option because
Okay,
a lot of people have a hearing loss because of the nerve weakness or the nerve
yeah,
problem. We call it a
okay,
sensory neural hearing loss. So for them, hearing aids is the only option. But if you
okay,
have younger children or some people who can afford, they can always go in for a cochlear implant, which is like a surgical procedure where they
okay.
insert some electrodes into your cochlea, which helps you hear.
Acha. Yeah,
So it's usually done for younger children because if hearing aids are not something which they're benefiting with, cochlear implants
yeah,
can be used. There are a lot of procedures for that because it's a surgical procedure, but the
yeah.
easiest option would be a hearing aid.
Okay. So, for everyone listening to us right now, is there something that they can do to protect or improve their hearing?
Hearing, yeah. First thing is not using earphones in very loud manner. Don't put you listen to music or anything more than 50% of your volume. You should not listen to it for more than half an hour to 1 hour a
Yeah.
day. I know all of us have the habit of listening to music when you're doing any kind of work, walking,
Yes.
whatever. But make
Yeah.
sure your volume is minimal and give yourself some breaks. Like, listening to for 4 to 5 hours a day, that's really hard for your ears. And now that a lot of people are working from home, you would be using earphones all the
Yes.
time. So cleaning your earphones, that buds what you have here, best to clean
Yeah.
it often. Your wax shouldn't be stuck. There shouldn't be other dirt. And giving yourself breaks in between, like not listening to music continuously. And if you
Yeah.
go to concerts or if you work in a job which has a lot of drilling or a lot of noise, using earplugs helps a lot. Earplugs or earmuffs, that helps protect your hearing in the long run.
Oh, that's great. Thank you so much for informing this.
Yeah, I hope you
Um,
all start following it.
yeah, yeah, definitely. We should actually follow that when a phone or a device gives us that caution not to
Yeah, yeah,
exceed the
to
volume.
not to
Yeah.
exceed the limits. Yeah.
Yes. We saw a post of yours where you mentioned that therapy should be fun for like everyone.
Yeah.
So you must be interacting with people from all the ages. How was your experience? Like how you deal with different age groups?
So, you'll have to get tuned with the age group. Like if you have younger children, you'll have to be very playful. You have to be like
Yeah, yeah,
pretending. You have to have a lot of puppets and games and all that. So you will tend to do that. You'll have to be very expressive, exaggerating, all of that. And
Yeah.
if you have a little older age group, you will have to, dumb it down. You'll have to be like face to face with them, that sort. And if you have like older people, you'll have to talk to them about their experiences, ask them their opinions, something like that.
Yeah. Okay. If someone wants to pursue their career as a speech pathologist, from where do they begin actually?
So in India, it's a 4-year bachelor's course what we do to become a speech
Okay.
pathologist and an audiologist. It's a
Okay.
dual degree. That is, you become an audiologist as well as a speech therapist. So
Yeah.
it's a 4-year bachelor's degree, and then you can do a master's degree as well, which is a 2-year degree. I have done my
Okay.
master's as well. So you can find a lot of colleges in India. There are I think I'm not sure about the number of colleges, but there are many colleges all across
Yeah.
India, but not in every city or so. Like for example, in Bangalore, where I stay, we have 2 or 3 colleges. You have
Yes.
some in Mysore, but not in all the cities. So in Mumbai, it's there. In Delhi, it's there. So you'll have to find the college and then decide if it's right for you and go in for it. Because becoming a speech therapist, you need patience. You need to
Yeah.
have some kind of empathy and compassion towards helping people.
Yeah.
And patience is key because you will not see improvement immediately. You'll have to bond with your patient. You need to listen to them. All of that
Yes.
happens. So
There'll
it's
be like a lot of trial and error methods which you
yeah,
have to do. Yeah.
yeah. Because what works for one case patient will
Yeah.
not
Yeah.
work for another. So
Yeah.
if
Methods
even
are
if not,
definitely unique
yeah,
for
yeah.
everyone. Yeah.
Everybody. So that is how you can become. So if I have put up a list of colleges which most people think are good colleges in my profile, it's pinned on my highlights. They can check it out if they're interested in becoming a speech therapist.
Oh, okay. So I would definitely request the enthusiast present here, please go and check it out as soon as possible if you're interested in pursuing this as your career. And we will be saving this live session, so don't worry at all. You can switch on to Girls Buzz or Manasa's account, and any time you can check all our conversation there. And
Yes,
even if you have any question, you can reach out to us anytime.
yes, definitely.
Yeah. And like last but like not the least, any message you would like to tell our audience to create awareness about normalizing and inclusivity?
So
Because we
I would
just
say,
saw that post on your account that said that if wearing specs or glasses, it is cute and normal, then why not having hearing aids?
hearing
I
aids,
love
I
that. Yeah.
know. Thank you. So I just want to tell everybody that, don't just stare at a person, don't stigmatize a person just because they are different from you. They're also
Yeah.
the same. Maybe they just have a hearing aid because they can't hear. Maybe they can't walk. So, they're
Yeah.
having wheelchair or something. But you can't just make them, stigmatize them or point out at them just because they're different from you.
Yeah.
Everybody's different, everybody's beautiful. Just because they have some differences doesn't mean it's wrong. And disability is
Yeah.
not something which is like, oh, you need a stigma, oh, you're like, worried about them. It's just a disability
Yes.
which they have, and they're okay with that. So I would say if you see posts like this, learn about it. Just, put your eyes into it. So for example, September is Deaf Awareness Month. You read somewhere about it. I would like if people could just read a little bit more to get aware about it,
Ever.
because you're
Yeah.
just living in a happy bubble that, oh, everything is okay, but there are people with disabilities who have to battle
Yes.
something every day. It would help if you're just aware of it, that's all.
Yeah. Totally. I'll just take 2-3 seconds to scroll out so our text to check if
Yeah,
there are any questions.
I think the first question is how long was I an SLP? So, as I've been a speech therapist only since 1 year, but
Yeah.
what we do is when we start our bachelor's only, we start taking patients right from second year in India. So I've been seeing patients in second year, and I just finished I've been an SLP working in a clinic since 1 year.
Oh, okay. The next question is any message for the women out there who need speech therapy but are hesitant to accept it?
So I know it might be hard, but just getting into it will help you out, because speech therapy is not something which will, force you to do something you're not comfortable with. you can always talk to your speech therapist about anything. You can just approach them and see how it goes. Find the right therapist for you, because not everybody works for everyone. So
Yeah.
just getting the first step of getting to know the therapist and then starting off will help, because trust me, I've seen a lot of older or adult patients come to me. They're very comfortable after a while. They get to know you and you can get comfortable with them. So find a therapist you can get comfortable with, and then
Yeah.
it'll all be smooth sailing from then.
Definitely. Then there is someone who is asking, ma'am, what is the scope of this course in future? Okay, so course के बारे में पता ही नहीं होता किसी को. Okay, so
Yeah,
please
I
help her out.
know people are not aware of this course, mainly because it's not very easily available. When I joined this
Yeah.
course, I had no idea what I was getting into too. So if you have any doubts about this course, you can ask me, you can message me, and my DMs are always open for this. A lot of people ask me about this as well. So I can send you a voice note about what exactly you'll be doing. But I guess you would have got an idea based on what I spoke about, that you'll be dealing with children, adults, people with communication, speech disabilities, like that. So I know that if you Google, you will not find a lot of information about what exactly a speech therapist does, especially in India. You can always message me and help me out, but the scope is good. Like, I can say personally, I am in this field and I would say it's good, and there is a lot of need for speech therapists, mainly because a lot of people these days are being diagnosed with speech and hearing difficulties. So there is a need, and the scope is good, is what I would say.
Yeah. So there is another question. Someone is asking if the child is having autism with mild to moderate spectrum, will they uh, will they be able to speak normally like us?
So first thing is, normal is something which is different for everybody. My
Yes.
normal might not be your normal. So normal is something which I tend to not use, because it's not like you want your child to be like a robot. You want a child to be normal for him to function in an everyday world. Not like that, right? Your child can be different and still be okay. Different is always good. It's not something which is like really bad. So if your
Yeah.
child has autism, based on what your speech therapist say, they can communicate. So some children with autism communicate verbally, some of them communicate with a device, or some of them communicate using actions. And
Yeah.
that is also normal. Like, we are the ones who are defining what is normal. So I would say, if you are worried about this, talk to your speech therapist and figure out what is the best way for them to communicate, because verbal
Yeah.
or talking like me and you is not the only way for communication. I could still talk to you using sign language. I could still talk to you writing about it. Basic
Yes.
thing is that you understand what I'm trying to say. So, normal is something which I don't want to tell that, yeah, your child should be normal, because it's something which we have come up with.
Yeah,
So if
normalize, like the normal term is definitely out of boundary. We don't have any
Yeah,
limitation for that.
exactly. So a
Yeah.
child communicating with sign language, I still consider normal.
Yeah.
So, how your child would speak depends on your child, each individual preferences, the therapy, everything. So it's always, I can't just make a general statement. Talk to your speech
Yes.
therapist and I'm sure they'll be able to help you out.
Definitely. Um, so I don't see any more questions for us.
Okay.
Just a minute.
If there are any questions, you can always DM either Girls Buzz or me.
Yeah, definitely.
I hope everybody got an idea of what exactly a speech therapist does and
Yes.
how speech therapy works. If you have any questions, you can always check it out, check out my account, or just DM any of us. We can help you out with this.
Yeah. So yes, no, this was all about the questions. Yeah. Thank you so much, Mansa, for being
No
such
problem.
a cooperative person and the sweetest person to
Oh,
aware about the things that we need to learn. And this is such a like not sympathetic. It's a very serious topic, and the way you present it to the world, it is actually wonderful. And people who actually went through your profile, they should know about it. Definitely.
oh, thank you so
You're
much.
doing a
I
great
really
job.
hope more people know about this. That's all.
Yeah, yes. So
Okay then.
thank you so much and all the best. You're doing wonders. And
Thank you for having me.
oh, it was a really an awesome session for me. I
Thank you.
thoroughly enjoyed talking to you and knowing a lot of stuff about protecting my ears too. So thank you so much.
Yes, please protect your ears, everybody.
Yeah. Thank you. Take care. Bye
All
bye.
right. Thank you. Bye bye.